Okay, welcome back to the Independent Doctors of Pahrump. And as you know, if you've been watching the first segment, I do have Kelly Adams, the CEO of Desert View Hospital, as my guest tonight. I'm very honored to have him out of his busy schedule come and talk about what's going on in the hospital. In that, we have Amy. Amy, are you on the phone?
Yes, I am. Hello, Dr. Reiner.
How are you doing? What can I do for you tonight?
I'm doing great. I have a question for Kelly.
Yes.
About the emergency room. He mentioned that he was talking about hiring third-party people for the ER. And recently I was in the ER, and I was reminded of another woman that was saying not all of the bill was covered that she thought would be covered. How does that affect Senior Dimensions or Humana in regards to billing third-party doctors, even though the hospital is in the plan?
Right.
The doctors may not be.
Right.
So I was a little confused about how that works.
Yeah, no, you've hit upon a real issue, and the hospital is contracted with, I think, all the payers that are out there, all the insurance companies. Some of the physicians may not be. The reimbursement has been a little bit different, and I know they're striving to be on all those panels. I call them all those healthcare insurance panels. They may not be on now. Sometimes it takes a couple of years for these groups to get on all the panels. The insurance companies tend to control the healthcare dollars, and you see this in your office all the time, Dr. Reiner, and it's no different with the emergency physicians. I can't speak for them, but I know that they're not on all the insurance panels, and it makes it difficult when, although the hospital is covered, sometimes the physician. The ER physician fee is not necessarily covered.
Right.
And that makes it a little more difficult for the patient. There's a little more sometimes exposure there to the ER physician.
Yeah, and if you're not covered under the ER plan and you do see ER doctor, they bill for their own services according to the rates. So it's very likely you will get a bill from that ER doctor, but your CAT scan and your ancillary services that are ordered by that ER physician are indeed covered by the hospital.
They are covered under that plan.
They're covered under that
plan. It's an emergency plan. All plans will pay for those, pay the hospital fee.
Right.
And then I know the docs are trying to get those covered.
Well, and therein lies what we were talking about earlier, which is if you are a patient and you do have an emergency, then yes, that's something you have to do, but making sure that you're not using the most expensive point of service for routine care is a way to avoid unnecessary fees, because some insurance plans actually will deny the ER because they need a prior authorization or they need something else to be able to get in that. So, this is where I say it's just very difficult for even patients walk in my office. They're not, let's say I'm not on Blue Cross Blue Shield and they walk in. Then I may see you anyway, and I may give you a bill, but Blue Cross Blue Shield's going to send a check to that particular person and I may never get it.
Yeah, you may never get it.
I may never get it. So.
Again, that's the, healthcare reform, and maybe that's a segue into one of those things is healthcare reform really wasn't healthcare reform. It was really kind of insurance reform. And it kind of amplified the problems that have exacerbated the industry for a long time. And although more people have exposure to some healthcare insurance, not everything is covered, and we're finding patients that will present to the ER, or even in your office as well, that have had deferred health care, if you will, deferred self-maintenance. Now, they've got 10 or 12 or 15 things wrong with them as opposed to 1 or 2. And they're finding that the cost to those patients to get them back on track is very, very costly.
I agree. They've gone without health care for such a long time. They've let their systems run down, and finally they have health care and they come in with a multitude of problems. And you're like trying to figure out 15 different problems, and you have to sort them out and get them. But time doesn't always wait, and those patients, may crater and may have a bad outcome and may go to the hospital, and now you're dealing with a multitude of problems. And I've always felt that it's good that they were able to get the health care. But I think that patients, if you're listening to the show, need to develop some patience with the healthcare system. We're like the proverbial python that's swallowing the cow. We haven't been able to digest what has been really thrown our way, and it's going to take a while for that to move through the system for us all to adjust. And you know, when you say insurance reform, I believe that this is a case where it could have been done so many different ways, but to have these high deductibles really didn't solve any problems at all.
Yeah.
All it did was, if you want pre-existing conditions, the insurance company had to be able to absorb that cost onto you, and that didn't do anything for anybody.
No, it really didn't. The piece that it did, it was a political move. Mm-hmm. It wasn't a healthcare move, Dr. Reiner, as you know.
Oh, absolutely.
It was, unfortunately, you know, we're in the industry. We've got our responsibility and charter is to take care of the patients. Well, you know, the political piece has been moving around so much that in fact, you know, I've been doing this for 34 years, and typically, you know, I make the plans for a year, 3-year, 5-year plan. It's impossible to do that now. Mm-hmm. You know, I have to make lots of short-term plans because, you know, we don't know how the political winds are going to turn in Washington. What's going to happen to the healthcare reform? What's going to happen to, you know, the relationship of all? I mean, it's going to twist.
Yeah, what's going to happen after the next election?
And so healthcare has now become a political pawn, unfortunately, and the patients, all of our patients are going to wind up paying more with this.
Yeah, absolutely.
It is not fair to the patients.
It's not.
It's not. You know, it's not your fault. It's not the hospital fault.
No.
It's the environment that has created that.
Absolutely. Amy, you still have another question?
Yes, I do, please.
Go ahead.
Okay, you touched on one more thing talking about this, and that is getting pre-authorization to go to the ER, which I did. I called my provider, but they did say make sure that they get pre-authorization for any testing or anything they want to do to you. Mm-hmm. Well, I'm in another area, so I don't know if they're doing that or not. So can you kind of enlighten me on that procedure? Would they do that automatically, the help that you have in ER?
Yeah, you know, the emergency room is handled a little bit different, as you know. When, you know, if you present at the emergency room because you have an episodic issue, it needs to be taken care of right now. You really don't need a lot of pre-authorization, at least generally, for a quote-unquote an emergency. You're in, you're sick, you got to get taken care of. If there are follow-on visits, that's where, you know, pre-authorization would need to be taking place. You know, for outpatient visits, for screenings, other things like that. I don't know of too many insurance companies that would require a pre-authorization to go into an emergency room. You know, you're sick, you're ill, you have a heart attack, or whatever the acute issue may be. They understand that, and they ought to be paying those emergency bills to the hospital.
It was more about being admitted, and then after you're admitted, if they want to do an MRI, make sure you get that authorized, for example. If they want to do an EKG or whatever, make sure you get that authorized before they do it.
Yeah, no, I totally agree with that. And not only Desert View Hospital, but any other hospital, you know, they ought to be going through that same thing. You know, we want it pre-authorized for you as well as for the hospital. You know, everybody's got to make sure that those dollars go back and forth. I mean, that's a pretty straightforward deal, and a great question, quite honestly, good exposure to that.
Yeah, and that case came up, you know, as one of the things that comes up a lot of times, which is that if it's truly an emergency that you have the test done, the diagnosis and the condition will dictate that those things were done correctly. If they were done inappropriately, meaning that, you know, and this happens more on an outpatient basis, or this happens more in places other than the hospital, because the clear history of what the patient presents with, the diagnosis dictate that you do a certain logical thing. One of the things that's very important, Amy, which is always, and it's very difficult in this state more than other states, is tort reform. Tort reform will go a long way to reducing healthcare costs because one of the things that happens in the emergency room and any ER situation is you don't want to answer the question, well, could you have done that test? Well, hindsight is always 20/10, and therefore one of the things that will help the cost of care is basically to reduce the liability by trusting a clinician's judgment that, no, I didn't think that that test was necessary, not a expert who is sitting in a chair in California who says, oh, yeah, they should have done that. Oh, yeah, they should have done that. And next thing you know, you've got a lawsuit that comes out of that. So.
Yeah, no, preventative care, preventative testing, you're right. Tort reform has passed in several states. It hasn't passed here yet.
No. And
and it will drive the cost of healthcare down.
It does
a little bit.
It does. I mean, when you limit the awards and the unnecessary lawsuits, that will help to do that. But from a patient standpoint, Amy, one of the things, the lessons to take out from this is it's very important for all patients to keep up with that preventative health care, to get into your doctor, to get that appointment and make sure you're keeping up with what you need to, because that emergency room may not be there when you need it, or the wait might be too long. This is where it's on you to take care of yourself, because no one else will do it other than you. I mean, the ER system may be there, the hospital systems may be there. Certainly, it's nice to have all the testing. It's nice to have all of that stuff. But I had a patient today that told me that she had to wait 40, I don't know, maybe 18 hours in Vegas to get surgery done. It actually was a representative for a pharmaceutical company because they couldn't get an anesthesiologist to come in to do the surgery.
Really?
Yeah.
Wow.
So
well, wait times is a big deal in emergency rooms. They're overrun, and that was one of the things that I think Amy brought up with her prior question. Is with the New York group, our community hospital here had a fairly significant wait time. Well, that is down to just a few minutes now.
Right, but you did a good job there. You got a new group in there. And
the new group, and they understand throughput. They understand. Let's focus on the issue. There's a lot of other training that goes with that as well.
Right. No, I think that was not that I had any problem with the first one, but it was something you saw on your end. I didn't see it on my end. And I think that is, like I said, those are the services that you upgrade. We're going to be going to break here in just a minute, and I want to thank Amy for calling in. And certainly, if you're out there and you have other questions for me or questions for Kelly, this is your time to get them on the screen and air those out. We'll be talking about, Kelly has a really good insight into the progression of healthcare, and he wanted to get into that on the last segment, but we were busy dealing with Amy's concerns. So we'll be right back. Thank you for tuning in tonight.